benefits and the risks of HRT are, because there's lots of different options, there's lots of different types these days. We're certainly seeing more women accessing menopause care, which is absolutely brilliant. So here are some just generalizations, and these risks and benefits may well be different for individual women. So that's why we would like to tailor our care specifically for you. Now, more women will die from cardiovascular disease than breast cancer, despite breast cancer probably being the one that we associated with HRT and the risk. There's a massive gain in having HRT in terms of improving our cardiovascular health. There's a significant reduction in incidence of if you start HRT before the age of 60 or within 10 years of menopause. So that's not when you start perimenopause or having symptoms, but actually going through menopause. So if women come early with perimenopausal symptoms, then we're starting easily within that 10-year window, because they will most likely go through menopause within that 10 years, but they'll be on it during that time. Or if you've already gone through menopause, it is not too late. And that's really important to know, because just having gone through menopause does not mean that symptoms resolve, unfortunately. And for many women, they can take years or decades, and some may find them going well on into their 80s, particularly if you're getting genitourinary symptoms of menopause. So please seek help and don't feel that it is too late, especially if you didn't go through menopause until your late 50s, then actually that window of opportunity spreads into your 60s. There's a reduction in atherosclerosis, which is the furling up of the arteries around the heart, and therefore reduction in coronary heart disease and death from cardiovascular causes. So there's no increase in cardiovascular events or mortality if you start it within 10 years after menopause. And this is the biggest killer of women postmenopausally, and this is a massive health benefit to have. Osteoporosis means thin bones, which makes them more prone to fracture. HRT is protective against osteoporosis and bone fragility fractures. The protection depends on the dose and duration of HRT, but we know that statistics tell us that 1 in 2 women and 1 in 50 men over 50 will sustain an osteoporotic fracture, meaning that 50% of us will suffer this. And unfortunately, the statistics going forward, having had a fracture, suggest that 10% of women will die within a month, that first month, and between 20 to 40% within a year of having an osteoporotic fracture. So this is something we must be looking after our bone health. HRT is licensed for 2 things. One is menopausal symptoms, and the other is for the prevention and treatment of osteoporosis. So it really is good at protecting your bone health. And this is really important, and the reason why we will always put women who go through menopause prior to the age of 40, which is called premature ovarian insufficiency, will automatically go on HRT to protect their bones, because they're going much longer without having that bone protection. So if you go through menopause early, before the age of 45, then you really want to be on HRT, regardless of whether you have additional symptoms, because you are having a much longer life without that additional bone protection. We know that during menopause, reducing estrogen levels leads to an increase in bone breakdown, which leads to greater bone loss and ultimately to osteoporosis. So eating a balanced diet rich in calcium and vitamin D, doing weight-bearing exercises, stopping smoking, reducing alcohol intake, and looking at HRT. These are your really good options for protecting your bone health going into our postmenopausal years. Hormone replacement therapy has been the subject of many ongoing debate regarding its role in cognitive aging and the risk of dementia. Estrogen, in particular, is thought to exert neuroprotective effects through its influence on cerebral blood flow, synaptic plasticity, and beta amyloid metabolism. So it reduces oxidative cell damage. We know that estrogen is a really important anti-inflammatory hormone, and that's true in the brain as well, because there is absolutely tons of estrogen receptors there as well, and it suppresses neuro inflammation. So it's definitely thought to have some benefits in terms of brain health. Now, whether that's translates directly into reductions in the instances of dementia or Alzheimer's disease, which we know is more prevalent in women. We're yet to see that data really distilled down. There's some conflicting reports out there, but we absolutely know that HRT does not worsen dementia or cognitive decline, and if anything, we really think that it probably improves it. What we do know is that there was also a groundbreaking study which was published last year, in June last year, which for the first time ever, estrogen activity was measured in live human brains. And so this was really important to see, because what it showed us was that in our brains, that we actually, when we start to lose estrogen, it actually increases our estrogen receptors in our brain rather than reducing them, which just shows how important estrogen is to our brain, because it's really trying to mop up absolutely any type of estrogen that is available to it. I'm hopeful that in the coming years this will lead to an enhanced understanding of how estrogen affects the brain health and the potential benefit of HRT on cognitive function. And those studies are ongoing, and I'll keep you updated. Risks: oral HRT, we know, is a bigger risk of causing blood clots than transdermal HRT, which is why we give normally first choice would be to give you estrogen through the skin, because it doesn't need to go through the liver, and the liver is where all of our clotting cascade enzymes are happening, and so it's we can avoid all of that by using transdermal options. And if we are going to use oral HRT, then we're going to talk about risks, and we have a look at things like what type of estrogen, what type of estrogen are we going to give you, what history do you have of having blood clots, do you have a family history of blood clots, do you have other factors that are going to increase your risk of getting blood clots, like being overweight, not being able to move about very much, your age. So these are all going to be important when we talk about the risks associated with different HRT options. And it's about really reducing that and then weighing up the severity of symptoms and the degree of risk that we're willing to take. And often we can find a really good solution to that. The biggest risks, a lot of us will associate with HRT historically has been breast cancer. The risk of breast cancer it's mainly due to a study that was carried out in 2002, where there was an increased risk of breast cancer and cardiovascular disease associated with HRT. Fortunately, this study has since been re-examined, and new research shows us that for most women, the benefits of HRT far outweigh the risks. And it's also important to remember that the type of HRT that was used in these old studies was not the types that we're prescribing today. Every woman in the UK has a 1 in 7 chance of developing breast cancer, whether they take HRT or not. So you have a 1 in 7 chance of developing breast cancer currently if you're on HRT and if you're not on HRT. So there are a lot of other factors that increase your risk. These include getting older, unfortunately, being overweight, the amount of alcohol you consume, if you're a smoker, how much you're exercising, and also your family history, especially if you've had family members who have got breast cancer at a very young age. So until you reach the age of 51, there's absolutely no increased risk of getting breast cancer when you take HRT. And this is because you are simply replacing the hormones that your body would have been producing until the average age of menopause, which is 51. There is no good evidence that taking any type of HRT at any age significantly increases the risk of developing breast cancers. And studies have also shown that women taking HRT actually have a lower risk of dying from breast cancer, as well as a lower risk of developing diseases such as heart disease, osteoporosis, diabetes, and dementia that we just talked about. HRT containing micronized progesterone, so that's the body identical progesterone, is not associated with an increased risk of breast cancer. And we know that, so on the left-hand side of this slide, you can see a poster that's produced by the British Menopause Society on their public-facing website, which is called the Women's Health Concern, and I would highly recommend that to you. And it looks at the baseline risk being about 23 cases of breast cancer diagnosed per 1,000 women between the ages of 50 to 59 over 5 years, and 4 extra cases for women on combined HRT, and 4 less cases for women on estrogen only HRT. So this really tells us that the increased risk of any risk associated with breast cancer and HRT is really about the type of progestogen that you use. And even with, so we don't use the synthetic progesterone older types of HRT anymore that were done in the original studies from which this data is based. And so we're using newer progestogens which carry much lower risk. And we also need to think about that and keep that in perspective as well, that the risk of developing breast cancer is actually higher in women who drink moderate amounts of alcohol. It's 5 extra cases. Women who are overweight, that's 24 extra cases. Or if you don't do very little exercise at all, then that's actually the same risk as combined HRT. So it's really thinking about the degree of risk as an overall, and not just about the medication. If you've had a hysterectomy, then you won't usually require a progesterone element, and you can take estrogen only HRT. And like I said, studies have shown that if you take this type of HRT, then there's no increased risk of breast cancer, and you actually might be at an even lower risk than women who are not taking HRT. And just to say that there's no increased risk of breast cancer with vaginal or local estrogen, because like I said before, it's barely, if any, absorbed systemically into the bloodstream. Finally, we'll talk about ovarian cancer. It's very, very, very low risk. There might be a slight increased risk with HRT, but the absolute risk overall is really small. So if that's something in your family history, that's worth talking to your healthcare professional about. Endometrial cancer we've talked about really in relation to unopposed estrogen therapy. So if you're using estrogen only HRT and you have a uterus, then that would cause problems over a longer period of time because it increases the thickness of the endometrial lining, and that can sometimes cause endometrial cancer to develop. And so we just reduce that risk entirely by giving women with uterus a progestogen as well. And for that same reason, sequential combined HRT for very long periods of time might be associated with a slight increased risk, which is why we generally move women onto a continual regime before that point. There's no association with cervical cancer, and there's actually a reduced risk of colorectal cancer if you're on oral combined HRT.